90% of men and 80% of women's lung cancer cases can be directly attributed to smoking. As a health center employee, I hear about preventative health care on a daily basis and understand that preventing things that can lead to bad health care are something that we need to point out. So smoking, everybody sees advertisements for smoking and everybody sees the reasons not to. But as a health center employee, I'm obviously here to tell you guys why not to smoke. So the two pictures with the healthy lung and the non-healthy lung and the yellow teeth and the white teeth from people that haven't smoked obviously are all reasons not to. But I'm here to point out not only the health risk but also the financial and the social risk of being a smoker. So first of all, let's talk about the health risks. I'm sure you all know many of the stereotypical things, but getting down to the nitty-gritty can be important too for not only the short-term effects on your body but the long-term. So according to the CDC, the risk for coronary heart disease and stroke increase 2 to 4 times when people are regular smokers. Also, like I said before, lung cancer is very obviously attributed to it because of the inhaling of the smoke into the lungs. And for men, the risk of lung cancer increases by 23 times, and for women, 13 times. Those numbers are astronomical. Just doubling something is a big increase, but 23 and 13 times is definitely something to take into consideration before lighting up. And other coronary diseases can be increased by 12 to 13 times. So definitely something to keep in mind. Also, cardiovascular disease has been directly linked to people that smoke, as well as peripheral vascular disease. With that one, that is caused because of the decrease in circulation and the constriction of blood vessels. Abdominal aortic aneurysms can happen as well because of the weakening of the aorta. Anybody who has taken or hasn't taken an anatomy class, if they have to name an artery, the aorta is probably the one they should, so that shows how important it is. And it runs right in the middle of your body. If something goes wrong with that, then it can most certainly be fatal. The respiratory system is also at risk as well. Emphysema, bronchitis, and chronic airway obstruction are directly linked with being a smoker. Cancer is a very, very big deal as well. That kidney, pancreatic, throat, uterus, bladder, cervix, esophagus, stomach, mouth, as well as lung cancer can all come from being a regular smoker. Now, all these things can happen to your body, but some people don't respect their bodies. So, if those aren't reasons enough to not smoke, there are also financial reasons. According to PS.MOD, people pay more for insurance if they are regular smokers and they tell their insurance company. Now, that doesn't mean that they always will and that your insurance company will always know, but they also can lose money of their resale of cars and their homes if they smoke. So, you're throwing money down the toilet just by lighting up in your house or your car. And more on dry cleaning and dental care is spent because your teeth are going to get more and more yellow each time you smoke, as well as the pores of the smoke get into your clothes. So according to the Society for Human Resource Management, 5% of people hiring employees prefer to hire non-smokers, and 1% make a point to not hire people that smoke. Why that would come up in an interview as people having just normal, short summer jobs, that may not have happened, but with an actual career, it comes into play because they may be paying for your insurance, health, and other things like that. $97.6 billion is also lost in the economy due to lost productivity each year because of smokers, whether that's the cigarette breaks they take or the depleted health risks that go along with it and needing to take off work. So obviously losing money is really important as well, but just having a social life and having that be interrupted is something to keep in mind as well, and it can certainly be interrupted by being a smoker. First of all, going out with friends who are non-smokers and needing to leave the room or leave the situation because you need to smoke is certainly a reason to not break up your social life. And also, your clothes will smell whether you smoke inside, whether you smoke outside, in your car, or wherever else. It will get in your clothes and you will smell, which can be quite offensive to other people. Also, like I said before, teeth can be yellowed and then it can be taken care of with higher dental work that would need to be done. And just interrupting your daily life in general. 20% of Americans are smokers. This is a huge decrease from what it used to be 20 and 30 years ago. But that also means that if you're in that 20%, 80% of the people around you are not going to be smokers. So that can cause awkward situations with needing to remove yourself, or also just being around them while you're smoking is not nice. So being in college, a lot of people say they're just a social smoker. Well, according to WebMD, being a social smoker likely means that you're already addicted. You're just addicted to smoking while you're drinking or while you're out at a party or something. So being addicted to nicotine carries all those risks. So any smoking is going to increase the risk of cardiovascular disease, cancer, and like I said, you're likely already addicted. So in conclusion, keep in mind that advertising is going to come out there and try and give all the perks of why to be a smoker and how it's not a big deal and think social smoking isn't a big deal, with things like the Camel Orbs, which according to the New York Times is being promoted towards younger people. It's a smokeless tobacco that gets put in the mouth and absorbs the nicotine in your body, and they're flavored and they're said to look like Tic Tacs. So a lot of people are outraged because little kids are seeing their parents pop these things, and they can actually be toxic for younger people. So whether it's smokeless tobacco, cigarettes, or other tobacco products, it's really not worth the health, the money, or the social costs that accompany it.